Good morning, everybody. Once again, Dr. Salim is here with you guys. Let's discuss some more questions regarding the SPI examination from ARDMS. So the question is mostly, remember, like almost I can say 25 to 30% of the questions in the SPI, sonographic principles and instrumentation examination, 25 to 30% are specifically Doppler shift. So let's talk some question today regarding the Doppler shift. Be with me, and this will be a lot helpful. And let me share the screen with you guys, and let's make again our ARDMS examination easier. How we can, with the first attempt, we can pass the exam. Okay, the question is, it says, if reflected frequency is more than operating frequency, what type of Doppler shift is achieved or received? What do you think? So keep in mind, the key word here is that it says the reflected frequency is more than operating frequency, or more than initial or transducer frequency. What do you think? Correct. I'm agree also. So it will be positive Doppler shift because reflection is more than operating. Correct. Okay. When we are using 5 megahertz transducer to scan popliteal artery, and we can say our returning echoes are 5.1 megahertz. So what do you think? What type of Doppler shift is achieved in this case? Correct. Positive Doppler shift again, because you can see receiving is more than operating frequency. Absolutely correct. Let's do the next question. Okay. So the question is, when flow is going away from the source of the pulses are emitted, or let's make it a lot easier, when the flow is going away from the transducer where the probe, you put the probe, so it's going away from that area. So what type of Doppler shift is seen or will receive or will be experienced? What do you think? The keyword is away, going away. Correct. Negative Doppler shift. B is the correct answer. Absolutely correct. Okay. Now, this question is a lot easier. Let's see if you can answer it. What is the best Doppler shift angle? It's just a generalized question. Doppler shift angle. Whenever we do Doppler shift, what do you think? Exactly. The best Doppler shift angle, the Doppler shift angle is 0 degree. Is the correct answer. Okay, now opposite question. What is the worst Doppler angle? What do you think? For the Doppler shift, which one is the worst one? Exactly. That is C is the correct answer. 90 degree. Because Doppler shift in 90 degree, either it's a minimum or no Doppler shift. And the maximum or 100% Doppler shift is in a 0 degree. Correct. Okay, easy. Let's do these questions. In Doppler shift equation, the formula, if propagation speed increased, what happened to the Doppler shift? Like, actually, basically the question is asking for relationship. What is the relationship between the propagation speed of the sound in the soft tissue and the Doppler shift? What do you think? Agree. Totally agree. Correct. B is the correct answer. It is decreased because propagation speed is denominator. That's below the baseline. Correct. All right. If velocity of the RBC increase, correct? Speed or velocity of the flow, if it increase, what happens to the Doppler shift in that vessel? What do you think? Like, what is the relationship between the flow velocity or RBC velocity and Doppler shift? Absolutely correct. I'm also with you. That is increases. A is the correct answer because they have a direct relationship. However, now in which angle of scanning while you're scanning your patient for the any arterials, so do we get the maximum Doppler shift? Like which angle will give you like 100% Doppler shift, I can say, almost. Just I mentioned it earlier. Correct. 0 degree is the correct answer once again, like we just mentioned here too, correct? Okay, let's do the next question. Okay, so these are the questions. It will help you a lot. 25 to 30% questions in the SPI. I think that's a huge number. So, okay, let's do this question. With which Doppler angle do we get the minimum or no Doppler shift? I just mentioned it earlier too. Yes, exactly. 90 degree. 90 degree will not give you any Doppler shift. If you are exactly on 90 degree, there will be a flow. Your box is on, your color Doppler is on, but you don't see the flow. It will just look like a 2D image in that area. Correct. Okay. Next, if fundamental frequency of a probe and receiving frequency from the Doppler study are the same, they're equal. So what type of Doppler shift or Doppler effect will be achieved or will be received? What do you think? What will be your experience? If your operating frequency and your receiving frequency, both of them, transmission and receptions are the same. So what do you think? What Doppler effect or shift you going to? Exactly, C is the correct answer. In that case, there is no Doppler effect or Doppler shift seen. You will be not able to see them because if, for example, if I'm getting one of the formula is, we can say initial reflecting frequency minus initial frequency. If both of them, for example, one is -5 and the other is +5. So the -5 and +5 will finish each other. So there will be no Doppler shift. The result will be 0. Correct. Okay, next. What is the relationship between Doppler shift and transducer frequency? I think this is a repeat question, but let's see if you can answer that correctly. Correct. It is a direct relationship. If operating frequency increase, probe frequency, Doppler shift will be increased. You will get more Doppler shift, more percentage. Correct. Okay. Spectral waveform above the baseline is what type of Doppler shift? Like when we do pulse wave Doppler, correct? Or continuous wave Doppler. So you can see the spectral waveform, which is above that part of the spectral waveform, which is above the baseline. What type of Doppler shift is representing that above the baseline spectral waveform part? What do you think? Correct. Positive Doppler shift. A is the correct answer. Absolutely correct answer. Okay, let's do this one. It says, normally, what type of Doppler shift is seen in venous blood flow? If you're looking for any vein and you want to evaluate it, normally, like in a normal situation, I'm not talking about a pathology. So what do you think? What type of Doppler shift do we see in a normal vein? What do you think? Correct. Absolutely. Negative Doppler shift when you do Doppler studies of them. Correct. Okay, next question. In Doppler shift equation formula, what is the relationship between Doppler angle to the Doppler shift? Tricky question, right? I will give you the formula. The formula is Doppler shift is equal to 2 times velocity of the blood flow, or RBC, times operating frequency of the transducer, times cosine of theta, or angle, everything divided by the propagation speed of the sound and a soft tissue. So now tell me, what is the relationship? Be careful, the question is tricky. What is the relationship between Doppler angle and Doppler shift in this formula, the equation of the Doppler shift? I'm sorry, you are mistakenly choosing the wrong answer. I know you said direct relationship. No, it's indirect relationship. It is a little bit tricky question because angle itself is indirect related. Cosine of angle is direct related. Cosine of angle is a number. And angle itself, like when you're in a 0-degree angle and you increase the angle, so where are you going? You are going toward the 90-degree, correct? With the 90-degree, there is no Doppler shift because it's a 0. And if you above the 90, like 100, 120, or you're going more towards the 100, 180, so you're going that way, you're getting negative Doppler shift. So correct? It's decreasing actually. So they have indirect relationship with the angle itself, but with the cosine of angle, it has a positive Doppler shift. Keep in mind, this is very, very, so the direct and indirect, with the angle, indirect relationship, but with the cosine of angle, it's a direct. So I'm sorry, here you did a mistake. I'm sorry. It's okay. We learn from our mistakes. So the correct answer is indirect. B is the correct answer. Correct. Okay, let's do next question. So here is the question. Very easy and simple question. If the cosine of Doppler angle increased, what happened to the Doppler shift? Just I mentioned, correct? That is easy. So it will increase. This A is the correct answer because it's not asking for the angle. Previous question was angle. Here, cosine of angle. So for example, cosine of 0 degree is 1, correct? And cosine of 90 degree is 0. So from 1, you're going towards the 0, right? So if you're looking to cosine of 180 degree, that's a -1. So you're going to the opposite direction in that case. Here, we can say if cosine, if they're asking for the cosine of Doppler angle, so it's the whole thing, the numbers, then they have a direct relationship. They will increase. So A is the correct answer. Okay, next. What type of Doppler shift is seen in the internal jugular vein normally? When you do the neck area evaluation for the vascular studies, so what do you think? What Doppler shift do you experience or achieved with your jugular vein? So what do you think? It's an easy question, but let's see what is your opinion on that one. Yep. So let's see. Correct. It will be negative Doppler shift. Remember, they were asking for the normal study. So in a normal study, it will be a negative Doppler shift. Correct. Okay, let's do the next question. So this was negative, correct? This is the correct answer in that case. Correct. Okay. Now, the red, we can say the red flow on the display explain the following. Choose the correct answer. Because we have a blue and red, correct, on the flow when we do any vascular study. So what do you think when you see the red, that's representing what shift? Easy question. Correct. It will be positive Doppler shift. Absolutely, that is the correct answer. Okay, let's do 3 more questions and then done. Okay, so this question is asking, what is the optimum angle? Let me just give me 1 second. I'm sorry, guys. Just 1 second. Okay. Yeah, sorry for that glitch. Okay, so now what is the optimum angle for the peripheral arterial Doppler studies? Which angle, like the best angle we can have? Easy question. Come on. You can do it. Exactly. 60 degree. B is the correct answer. 60 degree is the optimum. Now the question is, why 60 degree? Because if you go below the 60, you are correct. You're going to more better Doppler shift, but then your transducer will be not able, the pulses, to penetrate the artery in that case. So it will bounce from the artery. It will not penetrate it. If you make your angulation close to 0, like you're coming to 30, 25, 20, something like coming more smaller angle, that will be the problem. But why not more than 60? Because if you go above the 60, you are going close to the 90 degree. So you are losing sensitivity in that case. And cosine of 60 degrees, 0.5. And 0.5 mean at least you have 50% of Doppler shift to be seen, to be achieved, to be, have it. So 60 degree is the optimum. Now, what is the optimum Doppler angle for echocardiography? Doesn't matter, adult or pediatric echocardiography, but when you do echocardiography studies, what do you think? Which one is like the optimum angle for this heart evaluation or echocardiography? What do you think? Correct. Is the correct answer is 0 degree. Because with the 0 degree, we have the maximum Doppler shift. Correct. Because different angulation, either an echocardiography, you guys all understand, either we have, like most commonly used are 5 windows, right? We do plaques, parasternal long axis, parasternal short axis, apical 4-chamber, 3-chamber, 2-chamber, 5-chamber, and then we have subcostal window, and then we have suprasternal notch. So these are the 5 windows we use. So we try to make the blood flow and the pulses parallel to each other, and that is the 0 degree. Okay, now the last question for today. It says, what is the normal range of angle for the vascular Doppler arterial study? This is asking for the range. Before question, this question was optimum angle, like exact angle. Here the question is asking for a range, like which is a better range. What do you think? Correct. Yes. 45 to 60 degree. So between 45 and 60 degree, that is the range you can play between. Because anyway, when we do peripheral arterial study, you have to make your cursor parallel to the vessel walls. So that angulation is allowing you to play between 45 to 60 degree. Better to make it 60 degree. But sometimes some locations are not that much easier. Then, of course, you have a room for this to just make it between the 45 and 60. Correct. Okay, my dear healthcare providers, please, if these informations are very informative, productive for you guys, I'm sure it will help you a lot because most of students, doctors, healthcare providers, they comment me, they call me even, and they says, please don't stop these things. It helps a lot. It make me a lot feeling better and more confident that now I can pass my SPI examination. So thanks a lot from your positive feedbacks and appreciate it truly deeply. So please make sure to share the channel with all those healthcare providers who really need this type of information. Thanks a lot and see you next time. Thanks a lot. Take care.